Hi, and welcome to Faculty Focus, a podcast supporting the clinical education community in Leicester. We bring you Educator CPD, showcase new initiatives, and shine a light on some of the faculty behind it all. Hello, and a quick apology from me before you listen to this podcast. This podcast was actually recorded in September after the 2024 AMEE conference in Basel, but sadly, the release got missed. Discussion and content are not particularly time critical, however, do appreciate that the time lag is not ideal. Hope you still enjoy listening to Hussein and I and leave with some ideas for reflection, and we'll definitely do better for AMEE 2025. Happy listening.
Hello, and welcome to this episode of the Faculty Focus podcast. I am joined by my colleague Hussein.
Hello.
Yeah, it's working. It's brilliant. We've moved to a new recording platform, so it's all very encouraging that it seems to be working. This episode was going to be a little bit of a debrief, if you like, of the AMEE 2024 conference. It's quite a big conference. It's one of the biggest medical education international conferences, and it was held this year in Switzerland, in Basel, which is in the kind of north part of Switzerland. And we spent touring the various workshops and sessions of AMEE and a little bit of the city as well. How did you find it? What was it like? Because we both went to Glasgow last year, so it was very different.
Yeah. And that Glasgow was my first in-person AMEE, so this was my second, of course, first international one. Yeah, really great. Interesting to see the differences between it being in Europe versus the UK. Again, huge conference, and I was struck by that last time. This time as well, I think it was sort of 4,500 delegates.
Yeah, something like that. Yeah,
from all over. All over the world. And so, just walking around, you're hearing all kinds of languages, seeing the posters and the presentations, all the different insights from around the world. I think that's one of the most exciting things about it.
Yeah, I mean, it's a medical education conference for an organisation that's sort of based in Europe. Like a lot of these international conferences, it attracts a truly global audience. And 4,000 were only those that turned up in person. Of course, they had sessions online which were running in the early hours of the morning, and they stream a lot of the sort of key sessions, the plenaries, and some of the important symposia online too. So you can even access content that you may not have got to see at the conference. You can access that retrospectively. So just phenomenal. And each session, when it's not plenary, each session, I think there's 25 or more parallel sessions running with various different themes. So you've got an absolute dearth of content to sift through to decide what it is you're going to see. So but very good, very interesting. Basel's a beautiful city, probably like a lot of Swiss cities. Just the old town cathedral. Went up to explore a bit of the cathedral, and floating down the Rhine, which was also one of the novelties of that particular city. How did you find it?
Yeah, well, I remember when they said it was going to be in Basel last year in Glasgow, they said, come and join us in the river. And they had pictures of people floating down the river, and I thought that was not going to be for me. Up until I went in, I thought it was not going to be for me. But no, really, really great experience. The rivers, I think, because it's just come out from the Alps, it's really clear. Colder than I had been led to believe.
I can remember the day before we did it, when I did it then.
Yeah.
I was a little bit surprised. Once you're in.
Exactly, yeah. But a really nice kind of like, we went after the conference finishes on the Wednesday afternoons. Inevitably, you're sort of hanging around for a couple of hours, and I think it was a good use of time.
Yeah. So essentially, Basel sits on the Rhine River, and you have sections of the river for, I'm not quite sure how long, and down the river. It takes about 45 minutes to an hour to float down the river, and the outside thirds on each side are reserved for this kind of tradition of floating down the Rhine from one place to the other. And you have one of these special sort of waterproof bags you roll over and clip, a wicklefish bag, and and you just sort of see loads of people floating down. So both had a go at that. So,
and they told us that it's a commuter route as well, that some people just, instead of using public transport or driving around, they'll just float down the river to work.
They've got so much figured out in Europe.
Yeah.
Right. So a lot of sessions, a lot of stuff that we went to at the conference. I thought, I'll probably just start by saying is that there was A lot of stuff we're going to be talking about, I will put into the show notes. So there'll be links to a lot of further reading and materials that listeners may find useful if there's something that sparks your interest. So don't worry if you can't catch what we're saying, but it should all be in the show notes. And of course, you can contact myself or Hussein through the hospital emails if you have any further questions. One of the things I'd quite like to start talking about is AI, because that was one of the things we talked about last year at the debrief of the Glasgow conference. And it was probably a bit unrealistic last year to expect a lot of AI content because ChatGPT had only really been released, less than a year before the Glasgow conference. But this time around, it felt like there was a lot of good stuff out there. So if you're interested in using AI or how AI is being used in mostly to do with teaching clinical medicine, and this was a conference which had a lot of that. So I think there's probably 3 or 4 main ways that it seems to be used. There were various workshops and symposia I went to. So the first is content creation, whether that's pictures or text, and even interactive dialogue type functions of some of the AI. So you can create content. The other is help in creating questions from materials, whether that be articles or even creating questions related to your curriculum. And also the other big one is there was a discussion around how to use it in assisting with diagnosis and assisting with those conversations around ambiguity, how we can't just replace clinical decision making with AI, but it can assist in how clinicians make decisions. So those are the kind of 3 main things that I sort of took away, and there were some great tips and tricks we saw at the conference. Was there any other things that you saw it being used in? I know your BME group
Yeah,
quite a lot to do with it.
I think it's that you sort of touched on it exactly, that this time last year AI seemed like a sort of unfathomable, huge thing. And a lot of the stuff I struggled to sort of access it because it was really talking about the algorithms and the validation and really in-depth stuff. And I think in the year, it's kind of shifted towards the practical applications. So, as you say, we attended one session where actually they were going through commercially available free platforms that looked great. Summarizing, one was Ask Your PDF, where you just upload a PDF and you can ask the AI to just generate whatever you want from it, summarizing it, generating questions from it. Similar with ChatGPT, I think an understanding of how to use the prompt has become apparent. So in one session, sort of went through trying to create questions, and really nailing the prompt created fantastic questions. Again, still having to rely on human interaction with it and editing it a bit, but that's where I think we've come forward. With the BME session as well, it's really about trying to fathom the explosion of literature in AI. There's just so much of it now.
I should probably just clarify that BME is Best Evidence in Medical Education. So this is the group that you work with, which is to do with essentially a lot of these sort of meta-analyses or systematic reviews, isn't it?
Yeah.
That's what kind of specialty is.
Exactly, yeah, evidence synthesis. So, and there's just so much in AI now. So that was an interesting workshop because that was a sort of novel way of gauging from the participants where they want the research to go. So you get quite a lot of this with, faculty interaction or sometimes, patient stakeholder in clinical evidence synthesis, but I don't think it's really been done in education evidence synthesis. So we've tried to sort of pinpoint where does the education community want to see more evidence with regards to artificial intelligence. So some big topics, as you say, was clinical reasoning. So how can AI help with clinical reasoning? Also the sort of longitudinal logbooks, particularly in postgraduate settings where there's a lot of papers about surgical trainees inputting their figures and their numbers and complication rates and patient details, and sort of an AI portfolio developing through that. So that was a lot of interesting discussion there as well. And I think AI is going to it'll always sort of be there now. The novelty may wear off slightly, but I can imagine that there's always going to be sort of an AI strand to all of these conferences.
Yeah. I mean, we did a podcast, it's about a year, well, earlier on this year, I believe it was, and we looked at how people within UHL are using AI in their teaching. And, it was very new. So again, it was question creation and summarizing content. But this really did give you some fascinating ways of how you could use it. So, as you said, the key is to get the prompt right. So when you're asking it to do something, you're going to spend your time getting the prompt really nailed down. And then once you've done that, it really is a case of just applying that prompt to different situations. So, really I think the workshop we went to, we saw how you could create a patient history or a case. A typical thing you might, someone coming in with chest pain, for example. And once you've nailed down the sort of case or the patient, then you then could ask it to play the role of that patient in a consultation. So the AI then starts interacting with you in a conversational way, like a patient would, and say, I'd like you to play the role of an anxious patient with this history.
Yeah.
And he went from there, and then as you were asking it questions, it'll tell me more about your chest pain. Is there anything else in your history I need to know about? And it would play that role. And so you thought, wow, that's brilliant. Yeah, that's great. And then it said, terminate conversation and provide feedback to the doctor in this interaction. And then it just sort of, there we go, straight away, just gives you some pointers. Yeah, could have asked more on this.
Yeah.
Felt you dealt with my anxiety very well, or could have spent a bit more time exploring this. So, really just blew your mind on
totally
how you can suddenly opens up lots of potential scenarios and applications in an undergrad, particularly more for undergraduate, I would have thought, but also postgraduate. So really interesting. There was a symposium where they talked about AI in clinical reasoning. And so, everyone's quite worried about AI being used to diagnose people based on symptoms and signs. And I think the message was really not to use it in that way, but to use it as a way of use it to assist clinicians in making diagnoses or making management decisions. And the way to do that was really about asking it to provide alternatives and get you to think about and comparing and contrasting different potential diagnoses. So if someone comes in short of breath and with chest pain, you might say, okay, well, for me as a clinician, these are the diagnoses I'm thinking about, maybe asthma or COPD or a PE. And then the question would be, what in this history supports the diagnosis of each of these three, and what in this history refutes the diagnosis of these particular conditions, and compare what other information would you want to know if you were going to rule in or rule out these diagnoses. So that's a much more nuanced and much more useful way, I think, of seeing AI working alongside clinicians in their decision making than just saying, here's a patient, here's all the information, tell me what it is.
Yeah, exactly.
And I think that felt like a really nice marriage between the two. So watch this space really and to see how that develops. So I'll try and put in a reference for that session, so I'll stick those in the show notes. One of the other big concepts, so every now and again you go to these conferences or you read something and it makes you think, wow, this could be quite a big thing. One of those moments happened to me actually in my very first session. One of the workshop leads introduced the topic of adaptive expertise, and this is something which was very much aligned to other stuff that I've read about when you think, this kind of fast and slow thinking, system 1, system 2 thinking, also the idea of struggle in learning, the importance that struggle has in learning, and not just giving information and getting people to work with the information and come up with their own solutions. So this idea of adaptive expertise was introduced, and the difference between routine experts and adaptive experts. So routine experts are those where if everything stays constant and the same, they're very efficient at getting the job done. But of course, healthcare is not really one of those situations, and we have a very unstable, complex environment, and adaptive expertise is probably more what you need, because it isn't a factory production line where all the widgets are the same size and everything fits according to the instructions. So, and the distinction was that you need to think about how you're training people to not only know what to do, so that kind of procedural knowledge has to be there, but really the why, and that's what's called the conceptual knowledge, so that when they're presented with something that doesn't fit, they can then think differently, approach a task differently, and innovate and find a way through something which isn't sort of automatic pattern recognition. So there were a few sessions I went to on that, and I think it was one of the symposia that, as well as the workshops, which was really interesting. But we've talked about this before, the struggle needed in learning.
That's it. Yeah, and that was sort of something that I resonated with as well, and perhaps doesn't always fit with our model of education. The process of struggling, and it's productive failure as well, how to fail safely. The process of not always being successful in every single hurdle that you come across is educationally incredibly valuable. I guess we know that already, but a lot the big thing that was sort of driven home here was that struggle is okay as long as it's sort of done in a safe manner, but obviously clinically in a safe environment, but also in an educationally safe environment where, for instance, if you're setting up a teaching session, not necessarily adhering to the old sort of Bloom's taxonomy way of starting with basic facts and going towards more complex application and synthesis, but actually giving learners something difficult to start with, accepting that that they won't be 100% successful, but following that up with in-depth discussion and in-depth sort of analysis of why that's complicated, why that's difficult, and ensuring that safety is there.
Yeah.
Which I think is fascinating and pushes more towards that adaptive expertise when you know that situations are difficult and complex and may not necessarily have a single best answer. I think that's critical in healthcare.
Yeah. There was a session, I think, that was, one of the questions I think in that session was, well, what do you do about cognitive load? Because you're giving something that may be really overwhelming to somebody. And the response was actually, don't worry about the cognitive load, provided, you can manage out extraneous sort of, all the distractions and stuff like that. If the task itself is complex, don't worry too much about it, provided at the end, as you say, you bring it all together at the end. So the important thing is that after this struggle and getting it wrong, and may not even get the right answer, the important thing is bringing it together at the end and clarifying before people leave. So don't just leave them, hanging, because people will connect things in very strange and different ways if you don't do that. So it's that kind of safety net at the end where you put it all together. It does emphasize the role of psychological safety in this, because you're asking learners to potentially do things in an environment or with the trainer that they may not be familiar with. And we all know that all sorts of emotions and psychology goes on when you feel like you might be failing in front of someone else. So whether we can introduce things about how do we introduce psychological safety, how do we maintain that during a session, it's really important.
Particularly with it's the case with medical education all over the world that we work towards sort of pass-fail, high-stakes, summative assessments. That actually, if you have that system, then it's difficult to include failure and struggle in that system when you actually have sort of a binary pass-fail.
Yeah.
At each year. So perhaps something like this works more sort of in keeping with a programmatic assessment model, where you've got sort of more regular formative assessment across the entirety of training than where you have a sort of the binary system. Because that safety becomes even more important. If you've got a bunch of learners who are failing and you're intending for them to fail throughout the year and then saying, right, but now this time you have to pass, it's perhaps a bit of a struggle.
It is. And there was some ways, tips on how to actually practically do this as well, and I'll include the slide that I took a photo of. The sorts of questions. It's probably not a surprise, but the questions you're asking are, why have you rationalised it like that? Why have you decided to do that? And really digging down into that conceptual knowledge, but also throwing in a what if. So you may have a scenario, you may have something clinical in front of you, and you reached what you think is the plan or the right decisions. But then throwing in a what if. Okay, well, what if this patient was 20 years older, or what if there was this in their medical history, or what if we didn't have that facility at this hospital? How else could you manage it? So you're getting people to sort of think different permutations. So from one clinical case, you can explore lots of different other avenues, and that then really starts to push people to demonstrate that they truly understand something and what might work as an alternative.
Yeah.
Another question is what else? Really pushing further and trying to get to the point where they really genuinely don't have an answer. And that's that kind of level of, I guess it's zone of proximal development, isn't it? Vygotsky is really pushing you into that zone.
Yeah.
So the fringe, what did you think about the fringe?
Yeah, the fringe, I went, last year was my first experience of the fringe, and I seem to remember that there was a lot more of it last year. It was sort of an everyday thing and different sessions. This time there was just one big fringe session that had three presentations, 3 or 4.
That's right. Yeah.
And really engaging presenters, really interesting concepts. One was the use of memes, and it was more in a sort of a PhD setting, and how memes create a community of researchers and sort of getting each other through the process, but also then applying that to educational contexts. And the presenter was talking about they would ask students to create memes to reflect their progression, which I thought was really interesting. Nice sort of incorporation of a cultural phenomenon into education. The other one was cartoons. This seemed very professional, and creation of cartoons, again, to demonstrate medical student life and the struggles of that. I liked that the presenter depicted medical students as a traffic cone, because she felt like a traffic cone when she was a medical student on the wards. And I think that's an international thing. So I think she tapped in again to sort of socio-cultural phenomena quite well.
Yeah, the fringes for a new listeners, the fringe is one of those sessions at AMEE where it's a little bit more out there. It's usually got quite a heavy artistic element to it. And so typically there's music, poetry, visual imagery, that sort of thing. So this is why suddenly we've taken a bit of a tack on to sort of slightly more wacky things. But yeah, I think the use of manga cartoons to teach education and also explore some of the wider aspects of being a student was really quite clever. Although the one thing that we both had a head scratching about was like a bowel obstruction being caused by a mushroom.
Yes.
Getting stuck at the ileocecal valve. So like a whole mushroom.
Whole mushroom had undergone seemingly little digestion, and I couldn't tell if it was real or a joke. Because then, we need to do a literature review of this. Because then they was saying that they'd received pictures of real mushrooms causing real bowel obstructions in a similar way. So
yeah, so if there's any gastroenterologists out there who've pulled out whole button mushrooms or mushrooms that have caused bowel obstructions, and do get in touch, because it seemed like it is a phenomenon. Don't take our word for it, but it was weird how you take certain things away from sessions. Yeah, so some sort of more light-hearted sessions at AMEE as well. Lots of food for thought, really, when you come back from these things. There's always lots of ideas, running through your head. For me, with faculty development that we offer at UHL, there were some sessions on faculty development and got me thinking about how do we move forward. So we have a fairly established faculty development program in that we have teach-to-teacher courses, our 2-day courses that we deliver throughout the year. We also have our fellows that come through, education fellows, and other specialties will have their own fellows as well. We try and add a more formal study program to that in the form of a PG cert or a diploma or even masters to those fellows. So there is an individual development element there. And we're doing a bit more this year with our education fellows to try and bring them together and just make them realise that there's expertise amongst themselves and they can learn from each other and use each other to develop their projects. But I think there are some things that I think we could work on a little bit, and hopefully through the podcast we can do some of that. And I'm thinking along the lines of showcasing some of the work that we do at UHL and the university to see what other educational stuff is being done, and showing people there is a community of educators out there. Hopefully most of the people that are listening and spreading the word, really. Are there any sort of thoughts that you took away, things, little projects or ideas for things you might look to do in the next year?
Yeah, I mean, the application of AI, as we said, is a really interesting one, and I'm definitely thinking more about how I can incorporate that into day-to-day clinical life as well as the educational stuff. Interesting sessions I went to, and we caught up with colleagues from the medical school as well, ran a really great workshop about, it's been established in Leicester for a couple of years, but you sort of don't realize that it's really quite novel in the global perspective of education. They're on the IUPA exams, so they're sort of similar to OSCEs, but for preclinical students, incorporating anatomy, histology into a clinical context. And so they ran a really great session on that. And I think that the people who attended that as well found that really interesting, and that gave them sort of food for thought to implement similar things, similar approaches in their institutions. So that was really nice to see as well. But also coming back to the faculty development, we're two big institutions, educational institutions in Leicester, often doing things simultaneously, but not always doing things joined up. And I think there's so much that, I've learned from people at the medical school, and maybe trying to figure out some kind of collaborative approach to that as well. It seems like a good next step. Teaching fellows, for instance, we have fellows here and fellows there, and all in similar positions with similar sort of career aspirations.
Yeah, I think I really enjoyed one of the evenings. We had a good debrief really of the conference and concepts that we all think are very important, and hopefully the beginning of a collaborative group between the university and us, just to think about faculty development, other projects, just to help signpost people that are interested in developing themselves as educators. So yeah, hopefully we've got some date in the diary to sort of sit down over a pizza or something and think about how we can offer something more formal or more structured. But you're absolutely right. There's a lot of expertise on both sides of Nelson Mandela Park, splitting the Royal and the university. So yeah, hopefully great things to come. I thought we'd finish, so we're sort of around about half an hour now. So what I thought we'd finish is with some tips on anyone thinking about going to AMEE next year. So AMEE next year is in Barcelona. And that was the first AMEE I ever went to many years ago. It's a lovely location. The conference centre, if they use the same one, is very close to the beach, bring your swimming costumes. But I thought we'd just run through a few, and I've jotted a few down, but sort of feel free to add any that you think are relevant there, Hussein. But I think I'll start with, if you're going to go to AMEE, have a look at the program. Now, one of the things that I think we both found is that there are lots of streams running through the conference. Like we said, there's 25 or more parallel sessions running in every session of each day. So you really do have to have a look through the program. And you can do that through lots of different ways. It's probably easiest to do it on the app, but you can, of course, use a search function through the PDF, which I think was over 1,000 pages. So it's a big abstract book. So you can filter down. And if you're interested in faculty development, there's a faculty development filter stream. Or if you're interested in management or undergraduate specific stuff, there are ways of filtering it down. And you have to look at the title, but you probably also want to look into the titles of the presentations or presenters in each session that initially sparks your interest, because you can find sometimes when you turn up, it doesn't always hit the mark or it isn't what you expected. Sometimes you have to be unashamed of walking out and finding something else, because sometimes you get it wrong. Yes. So that would be probably my first thing, is that there's a lot of stuff out there and you've got to find a way of managing it.
Having backups as well, I think, is good, because quite a lot of the sessions were full. They don't let people in once it reaches the capacity. So looking through and picking out what you want to go to, but also what else you would go to if you can't make it to that session. The last thing you want is sort of realizing you can't get into a session, or you want to leave a session and wasting the next half an hour trying to figure out what else to go to.
Yeah, by which point you've missed it. Yeah, that's really important. If there are workshops you're really interested in, then get there early. Whilst the session starts at a specific time, some of the AI sessions were full up, 10, 15 minutes before the session started. So if there's stuff that's really important to you, then get there early during the break time. I think it's important that you can feel a bit overwhelmed. There's a lot of stuff there. It's full on. You probably don't want to go to every single session. You need a bit of time to process. So I certainly went off at a lunchtime to do the swimming in the Rhine, because I thought there's an hour here. I'll use that time just to kind of float down the river and reflect on things. But there may be sessions that you probably won't find that much that interests you, or you're kind of convincing yourself that there might be something interesting. Just make sure there's one or two sessions that you just take off and go and explore the place. So next year will be Barcelona, but it's nice to sort of wander around, debrief, have a chat, talk to others, and just even just be alone with your thoughts about various things if there's stuff that's really sparked your interest. So yeah, take a break from the conference. Anything else? What would you say?
Getting to know the app as well, I think is really important, because I didn't realize until halfway through that there was, as well as searching for other delegates, you can your name badge comes with a QR code, and you can scan each other's QR codes, and sort of it stores that person as a contact in the app. And then you can message people. And in Lisa and Jade's session, the workshop from colleagues at Leicester Medical School, met another histopathologist. And so that was a great way of getting each other's details and keeping in touch and sharing ideas going forward, because there is that sort of networking aspect to the conference as well that is quite exciting. So it's nice to maintain that if possible.
Yeah. Was that the only other histopathologist at the conference?
That I met, yeah. But this goes to show, this links back, because there was a session delivered by another histopathologist, but it was tucked away. It was all about eye movements. It was tucked away. The overall session didn't sound like something I would be interested in. But then I discovered afterwards that tucked in that session was a talk given by a histopathologist that I would have really liked to see.
Yeah.
You really need to scour through that program.
I think you're right. Sometimes if you use a search function on a PDF, you can search for those terms, like you say, your specialty,
exactly, yeah.
your geographic location, your specific names. So there are quick ways of finding what you want in the conference and bookmarking them.
And it's very easy to get overwhelmed. You sort of walk in and there's people walking around everywhere. There's rooms and sessions going on all over the place, and it's not always straightforward to find where you need to go and all that stuff. So that planning, I think, is really important.
Yeah. Interestingly, you just reminded me that there was a quiet room this year actually at the conference. So sometimes that frenetic environment can be overwhelming. We did a podcast not so long ago about neurodiversity, so there is a quiet room if you do need to escape and just be alone with your thoughts for a bit. So yeah. Other thing I'd say is, you're probably going to take cabin luggage, leave a bit of spare room, because you're probably going to want to bring something back. We had a rather expensive trip to a chocolate shop in Switzerland. Chocolate's really, everything's really expensive in Switzerland, and that chocolate too.
They were so expensive. And then I think we both got the same box. I thought that box had two layers in. You know how there's the first layer of chocolates and then there's a bit of cardboard and then there's a layer underneath. No,
Yeah.
this was about €50. I mean, each chocolate would have been like about €2, right?
Something like
Well, not euros, francs.
That's it.
But
It's
it was
like a
crazy.
1-to-1 ratio with the currency, wasn't it? Very expensive chocolates. So yeah, I'm looking at like Rosie's face when she's eating them. I'm like, join them. I hope they play with right. That's expensive.
Yeah.
Yeah. So we'll leave a bit of space for a souvenir in your hand luggage. I think we'll probably bring this podcast to a close. But yeah, as we said, next year it is in Barcelona. It's always held on that bank holiday weekend in August. So that is the weekend to mark in your diaries and your calendars. If you're thinking of presenting at AMEE, usually they start inviting abstracts early in the new year. So February time roundabout is when abstracts will open and they'll close usually a month or so later. So get your ideas in there. If you're working on a project now or you're coming to the end of something, it's always worth just throwing in an abstract because there's an awful lot of ways to present it. They can be short comms sessions. They are also on-demand sessions. So you can even record your 10-minute presentation and submit it. And that will then be available as kind of like a short comms or a little bit like a poster. So, there's stuff like that. But if you've got something more substantial, then there are lots of other types of sessions to aim for as well. So, consider it if you're thinking about publishing your work, and that's something which we'd encourage you to do. And it's always nice to see Leicester on the map at these sorts of things. So yeah, hopefully we'll see everyone next year. Was there anything I missed out saying? Was there any sort of nuggets I thought?
I think that covers. Yeah. It's a great conference.
Yeah,
I've really enjoyed it.
Fantastic. That's good. All right. Well, we'll wrap it up there. I think you've got something that you have to get off to. I think I probably made you late for it. Looking at the time. Whoops. I'll let you escape.
Nothing's more important than this.
That's what I'd love to hear. Good. All right. Well, yeah. Hope you enjoyed the podcast. As I say, check out the show notes if you like the podcast. Like and subscribe, and we shall see you on the next episode. Thank you very much.
Thanks for listening to the Faculty Focus podcast. If you like the episode, please share with friends and colleagues. You can also like and subscribe to the show and perhaps even leave a review. Clinical education can be tough, but we're stronger as a community, so if you have an idea for an episode or would like to come on and talk to us, do get in touch via email or Twitter. Details in the show notes. The Faculty Focus podcast, Community Development Showcase.